Good morning. I'm Scott Harrow with UMHS, and today we are speaking with,
Hi, my name is Dr. Andrieu Aguinaldo.
yes,
It's a
Dr.
pleasure to
Aguin.
meet you.
Great. Thanks for so much for taking the time to speak with us. And you recently matched at Prime West Consortium in Anaheim, California, and that must feel really great. And I want to wish you congratulations. And can you tell us a little bit about how it feels matching in California at this particular facility?
It's very simple. It just feels wonderful and such a great relief that not only to just match, but also match in my close to my hometown and also where I plan to build my career in medicine.
Mhm.
And matching close to home for me was really important because from the start of residency, I can begin to implement both the short term and the long term goals that I really envision being a part of my entire medical career.
Excellent. And what are some of those short and long-term goals for your residency?
Well, for short-term goals, just to be the best resident that I can be in my
Of course.
program. We're just finishing medical school and we have so much to learn. And for the rest of our medical careers, that's going to be a lifelong learning experience. And so just to be receptive and be willing to adapt and take in as much knowledge during residency to become the best physician that I can. When it comes to long-term goals, I definitely plan to branch out in primary care medicine and
Great.
also to look to see where I can impact the most patient lives in California and where I live in Los Angeles.
Okay, great. And we're getting more and more UMHS grads that are matching in California. And what's it like to be able to go to UMHS and match back in your home state of California? That must be awesome.
It it definitely means a lot to me. For starters, I get to be close to home, where my family and friends are, and second of all, again, like I said, it really does allow me to begin building those connections in the medical field with many colleagues, whether it's nurses, other physicians, PAs, or other staff who will be a part of the medical career that I'm going to build, especially in primary care.
Okay, great. And you must have, when it came time to apply to med school, I know you have a lot of really excellent med schools out there in California. What made you decide on attending UMHS for med school?
Well, for me, UMHS really provided the environment that allowed me to invest in myself and
Right.
grow to become the best versions of ourselves. That's something I believe we should all be striving for. And UMHS's opportunity in especially my third and fourth year clinical rotations really allowed me to branch out and find the kind of physician that I plan to be and how I want to operate in medicine, and also to help build the connections that really did help me eventually achieve the match and residency here in California. So I'm very thankful for all the help and the opportunity that was given to me.
Okay, great. And can you tell us one or two things that you like the most about studying at UMHS?
Well, studying at UMHS was really nice. What it starts with is the small class sizes. I think
Of
that
course.
really provides an intimate environment that allows you, as the student who still has so much to learn, to really be engaged in what you are trying to improve yourself on. And you don't feel lost as if you're in a larger class, and you always feel comfortable approaching your professors or even your colleagues and your peers about improving on whatever it is you're trying to get better at.
Okay, great. And are there any professors in St. Kitts or Maine or staff in the New York office or anybody in your clinical rotations that you would like to mention that really helped you on your journey to matching?
I can think of a few. I definitely would like to be thankful for Dr. Kumal Singh, Dr. William Levine in my third year, and then Dr. Mark Matthews in my fourth year. Mr. Jonathan Timmons from the UMHS administration has been very helpful in shaping my third and fourth year to really make a lot of things that much easier and smoother of a transition, even with the challenges that I experienced along the way during my third and fourth year. And it's with that sense of community and helping each other that I really never felt alone, even when it times got tough during clinical rotations.
Okay, great. Yeah, and I know Jonathan very well, and he's great. Are there any other things that you would like to talk about that we haven't covered about your upcoming residency or about UMHS in general?
I think it's really important, for me, as I've had my share of growing experiences during medical school, for anyone who's watching this, that whatever it is you want to do, you just have to trust in yourself and build that confidence. And it's with that confidence alone that the skill, the connections, and whatever it is you need to be successful will come along the way. But it's the confidence that will take you the distance, especially during the tough times. And it will also help you really enjoy the successes and also the victories that you will eventually achieve. So I
Okay.
hope that you guys take that to heart.
Okay, great. That's pretty sound advice. And anything else that you want to add about UMHS or about your upcoming residency that we haven't covered?
I'm just really excited to start. And it may seem like a large challenge, and residency will be. That's totally fine. But it's something that we really get to do rather than it's some other job that we're not sure if it's going to be for our long career. But this is something that we're going to build for the rest of our lives, and it's going to become a part of who we are. And we're also going to impact people that those experiences we share will also be a part of their lives. And I think that's what's really cool.
Okay, amazing. Well, Dr. Aguinaldo, I want to thank you so much for your time. I think you're going to inspire a lot of people, and I want to wish you all the best of luck in your upcoming internal medicine residency. And we'll keep in touch. Okay.
Thank you so much, Scott. All the best.